Hi, I'm Maddie.
Hi, I'm Darren.
I'm Charlene.
And I'm Alondra, and we are third year nursing students at the University of California, Irvine. And today we're going to be talking about how to care for high blood pressure.
This is a small outline of what we'll be talking about throughout the presentation. So first we'll go over what is blood pressure and hypertension. Then we'll go into the signs and symptoms, the risk factors for hypertension, and then different aspects of nursing care. So the first thing to be addressed in this discussion is actually blood pressure itself. So blood pressure is the pressure of blood that is pushing against the walls of your arteries once the heart pumps blood. So these arteries are what allows blood to be perfused throughout the rest of the body. So after the heart pumps the blood, the arteries carry the blood from the heart to the rest of the body, including all the vital organs and all of your cells. Blood pressure can also fluctuate. It is not constant throughout the day. So maybe like when you wake up, it'll be like low to normal because you're not as active. And then as you become active throughout the day, it will rise. And once you're like going to sleep and winding down, it could go low again. However, as long as it's within normal limits, you have nothing to worry about. Blood pressure is also measured using two numbers. So your first number will represent your systolic pressure, which is the amount of pressure in the arteries once the heart beats. And then your second reading will be your diastolic pressure. And this is the pressure in the arteries between each heartbeat. So basically upon rest.
So hypertension is a type of cardiovascular disease that is one of the most common medical conditions in older adults, especially one that's chronic. It's characterized by high blood pressure readings. And in patients that have hypertension, they tend to have a systolic pressure that is at or above 130 millimeters of mercury. And their diastolic pressure is going to be over 90 millimeters of mercury. And so most cases of hypertension are actually idiopathic, which means that they arise spontaneously. And some mechanisms that can cause hypertension is going to be a diet that is very high in salt intake, because that causes volume expansion in the body. Another mechanism would be an impaired response of the RAS system or increased activation of the sympathetic nervous system. And so these mechanisms can cause hypertension by causing an increase in total peripheral resistance and afterload, which in turn increases the workload of the heart.
Okay, so hypertension is more asymptomatic. So that is why it is commonly known as the silent killer, as there is no specific signs or symptoms to identify it. This is why you should be very adamant about your blood pressure readings. So it's very important to check your blood pressure because this is the only way to specifically know if you're showing signs of hypertension. And in doing this, you can log your blood pressure to be sure that you are showing continuous signs of high blood pressure, because if it's only one reading, it could be something else.
So these risk factors are basically just unhealthy behaviors that can cause an increase in the risk of hypertension. So one would be unhealthy diet. So if an individual eats a diet that consists of extremely high levels of sodium and very low levels of potassium, that can increase your risk of hypertension. Also physical inactivity. So if you have very low levels of physical activity or complete physical inactivity, that deprives the body of the benefits of exercise. And exercise helps your heart and your blood vessels to stay strong, as well as helps keep individuals at a healthy weight, which decreases blood pressure. Obesity is another increase in risk factor for hypertension. So obesity is when individuals have excess body fat. This causes for the heart to work harder in order to be able to pump blood and oxygen to the entire body, as there's more body to pump to. So this can cause for added stress on your heart and your blood vessels. Heavy alcohol use. So when individuals consume too much alcohol, this can in turn raise your blood pressure. So women should have no more than one drink a day, and men should have no more than 2 drinks a day. Another one is tobacco use. So smoking can damage the heart and the blood vessels. Nicotine can directly raise your blood pressure. Breathing in carbon monoxide produced when an individual smokes tobacco reduces the amount of oxygen that your blood can carry. Another one would be race. African Americans tend to have a higher incidence of high blood pressure, compared to other races in the United States. Chronic conditions like diabetes, kidney disease, and sleep apnea. So certain conditions like these can actually increase your risk of high blood pressure, and then also age. So the older you get, the more likely you are to get high blood pressure, and 65 plus is where you really are at risk for it.
Okay, now we're going to be talking about the different types of medications that you might be prescribed if you do have high blood pressure. So doctors generally prescribe these 4 types of medications. The first is called angiotensin II receptor blockers. An example of that medication is valsartan. And then angiotensin converting enzyme inhibitors. An example of that is lisinopril. Next is calcium channel blockers. An example of that is amlodipine. And the last is thiazide diuretics. And an example of that is hydrochlorothiazide. Your physician may prescribe you, start you by just using one of these medications, but depending on how severe your high blood pressure is, they might end up prescribing you more than one of these medications. Okay, next thing we're going to be talking about is medication instructions. So the most important thing to do is to make sure that you're taking your medication as prescribed. So medication for high blood pressure is typically taken every single day. So you want to make sure that you're never skipping a dose. It also means you have to make sure that you always have pills. So don't run out of your pills. Make sure to get refills on time. And if you have any questions about taking your medication, you should always ask your doctor. So for example, if you're going into surgery or a procedure where they ask you not to drink or consume anything before your procedure, just check in with your doctor and let them know that you do have to take a medication in the morning, and they can instruct you on what to do for that. The next important thing is to make sure that you're reading the label. The medication label will tell you when and how to take your medications. This is really important because some medications need to be taken before you eat, or they need to be taken at specific times. The label will also indicate any kind of side effects. So for example, the picture that I show right here on the left says not to drink alcohol when taking that medication. And then the picture on the right shows that you should avoid sunlight when taking these medications. And then the last very important thing is to never stop taking your medications. You may have days where your blood pressure readings are normal, but that doesn't mean that you don't need to take your medication anymore. You should only discontinue your medication with your doctor's guidance. And of course, if you have any questions, you can always ask your pharmacist when you pick up your medication. Now we're going to be talking a little bit about medication organization. So high blood pressure medications, like we said, are generally taken every day. So using something like a pill organizer ensures that you're taking your medications every single day, and it's especially great if you're taking multiple medications. So there are many different types of pill organizers, and we suggest that you choose a pill organizer based on the number and type of medication that you're taking. So the picture that I've included on the left shows just a basic daily pill organizer. It's divided by all the days of the week, so you can put all the medications within the corresponding day. And we recommend this pill organizer if you take all of your medications at the same time. So for example, maybe you're taking 2 types of high blood pressure medications and you take both of them in the morning. Now, if you're taking more than one medication and you're taking them at different times during the day, we suggest using a pill organizer like the one that's pictured on the right. This one's divided again through each day, but then it's further divided into morning, afternoon, and evening. So just take a look at the type of medications you're taking and when you have to take them, and that'll indicate which pill organizer you should use. And then it's also important to note that some medications need to remain in their original medication bottles, or they need to be kept in a specific environment. So this again goes back to making sure that you're reading your label to indicate if you can or cannot be using the pill organizer. Okay, now we're going to be talking about taking your blood pressure at home. So if you do have high blood pressure, it's important that you're monitoring your blood pressure at home because the doctor needs multiple blood pressure readings in order to know how you're doing. So because of this, you want to make sure that you're taking your blood pressure accurately. To make sure of that, you should start by making sure that you're sitting in a chair that supports your back. Then you want to place your arm at chest level, and you also want to make sure that it's supported. So in the picture, the man has his arm resting on the table and it's at chest level. Next, you're going to want to make sure that your feet are flat on the floor and making sure not to cross your legs or talk while you're taking your blood pressure. Okay, so now that you're in the right position, you're going to want to put the blood pressure cuff on. The most important thing is that you want to make sure that the cuff is directly touching your skin. So don't take your blood pressure while you're wearing a long sleeve shirt, and making sure that if you are wearing a short sleeve shirt that you roll up the sleeve all the way. The blood pressure cuff is going to be placed right above the folds of your elbow, and you're going to want to make sure that the cuff fits closely to your arm but not too tight. And a good tip is to leave about 2 fingers worth of space between your arm and the cuff. So now you can start taking your blood pressure. If you have an automatic blood pressure monitor, all you have to do is push the start button and it will automatically take your blood pressure. At this point, you want to just make sure that you're taking a deep breath and relaxing as the monitor takes your blood pressure. And now the last step is interpreting your results. So your blood pressure monitor will show a few different numbers on the screen. The top number is the systolic. So in the picture I've shown, the systolic is 106. And then the second number is the diastolic, and that's the number directly under the systolic. And in the picture, that's 65. And then in this specific picture I show, there is a third number, which is actually your heart rate. Not all monitors show the heart rate, but some do. But just the numbers you want to focus on are the systolic and the diastolic. Normal values for blood pressure is for systolic below 120 and for diastolic below 80. And then hypertensive values for systolic are between 130 and 139. And for diastolic, it's between 80 and 89. If you do happen to get a high blood pressure reading, make sure to just take a minute before taking your blood pressure a second time. You want to wait at least 1 to 5 minutes in between each reading. And then if you do get a blood pressure reading that's 120 over 80, that's when you should contact your physician and seek immediate help. And so now we have a short video just showing you how to do your blood pressure at home.
A proper diet is a very important part of managing your high blood pressure. In order to make sure you're eating along with dietary needs, it's important to always read nutritional labels on store-bought ingredients and before you begin cooking. Controlling your diet doesn't mean you have to cut out all foods. You can still have a variety of options on a diet for your high blood pressure. It's important to note that some culturally important recipes are not very hypertension friendly. It's important to speak with a dietitian to modify these recipes so that they can still be eaten with these dietary needs in mind. A major change you can make is limiting how much salt you eat. The DASH diet is the CDC's recommendation for what to eat to manage your hypertension. While serving sizes can be given on store-bought boxes, it's not always easy to know what exactly a serving is. The typical measurement for a serving is 1/2 cups for fruits and vegetables, 1 ounce for protein, nuts, and grains, 1 cup for dairy, and 1 teaspoon for fats and oils. Exercising is another very necessary factor to manage your hypertension. A lack of exercise can make your hypertension and other disease processes a lot worse. The CDC requires a minimum of 2.5 hours of moderate exercise a week. It's best if you spread this out into 30-minute intervals rather than all 2.5 hours at once. And exercise doesn't have to be something you dread. One day you can go on a half-hour walk. The next day you can spend some time playing with your grandchildren. Another day you can spend some time gardening or doing chores. It's important to pace yourself while you're exercising. This moderate exercise can be described as doing an activity while still being able to hold a conversation. It's important to warm up and cool down before and after each exercise to reduce your risk of injury. Some older adults have very limited mobility and can't exercise in traditional ways such as walking. Chair exercises are a great way to move with this in mind. These exercises should be done on a chair with armrests for support or with a caregiver nearby. You should always consult your primary physician to see what level of physical activity is right for you before you begin an exercise plan.
Okay, so as my fellow peer had discussed earlier, the nicotine inhaled when smoking cigarettes can cause your blood pressure to rise over time. This is why it is a great decision to quit smoking to further prevent hypertension or to help manage it if you already have been diagnosed with it. As we all know, it can be very hard to stop a habit, so you want to take it very slow. You can do it if you put your mind to it. The first step can be to plan a date that you will quit. In this plan, you will also include the medications and different strategies you will be using in order to successfully quit. And in this time, you can also find new hobbies to keep yourself occupied, such as exercising or watching a new TV show. In doing this, remember that there are so many pros to quitting. This will improve your senses, allow you to breathe better, and lose the cough that comes along with smoking. Your chances of living a long and healthy life will also improve because you'll be avoiding the chances of developing other diseases associated with smoking, as well as hypertension. If your blood pressure readings continue to increase after trying to manage hypertension with these different treatments, it is best to contact a primary health physician. High blood pressure has the ability to cause many other complications, such as some that are listed in this picture. Stroke, vision loss, heart failure, heart attacks, and kidneys and failure disease. If any signs or complications become present in the individual, be sure to make an appointment to visit your primary health physician. And if there are any immediate emergencies, it is always best to call the paramedics for help. For more information regarding hypertension, here's a list of websites you can visit. And thank you for your time. That is all we have for how to care for hypertension.